the National of Medicine. So we are based out of Charleston, South Carolina at the Medical University of South Carolina. And so today we have just a few housekeeping things with using Zoom. Closed captioning is available, and we will have it on the bottom of your screen. You'll have that little button that says closed caption. And so depending on the size of your screen, you might need to click on the dots that say more space, and it'll allow you to kind of adjust those settings as needed. And as you all are probably already aware, all of you have been muted, but we welcome your questions and comments in the chat at any time. I've got Molly monitoring the chat, so if you post anything, she'll be sure to make sure that it gets seen and we can discuss. So please be sure to select everyone from the drop-down menu if you are going to be posting in the chat. Again, we really welcome conversation and questions at any time, and we'll be monitoring that throughout. But before we get started, today's session will be recorded. And by being here, all of you have agreed to abide by the NNLM Code of Conduct. It's just a reminder that we are all here together professionally to learn. And we want to make sure we maintain that inclusive and respectful environment while we're here, and especially in the chat. Your cooperation is very much appreciated, and the Code of Conduct is available for you in that chat if you would like to take a look. And today's class is eligible for an MLA CE credit. And we will post that at the very end. You'll have that feedback, which we very much appreciate. It helps us better understand how we're doing, what your needs are, and how we can tailor ourselves to match what those needs are and maybe put them into an educational component. And we'll share that link at the very end. And as always, there's a speaker evaluation, which I very much appreciate because it helps me better understand my teaching strategy and how I can better teach to you all. And real quick about NNLM, in case you don't know, I'm sure all of you have been to one by now, but just for those that are new, the National Institute of Health is one of the nation's leading medical research agencies. Many of you might be familiar with the National Cancer Institute, which is one of the many institutes and centers at the National Institute of Health. NLM, or the National Library of Medicine, is one of those 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and MedlinePlus, all resources that we have come to know and love and probably use in our everyday. NNLM is the outreach arm of the program of the National Library of Medicine. So we work to ensure health professionals like yourselves and the public have equal access to health information. And to wrap that up, NLM is made up of 7 medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 network member organizations. And here's a map just to kind of show you where we're at. If you want to post in the chat where you're coming from today, which region, we'd really love to hear from you. It kind of gives us a little bit of a sense of community to know where other folks are coming, what they're doing. So feel free to drop that in the chat if you'd like. And if you would like to learn more about your region and how your organization can become a part of that, there's a link in the chat that you can visit, and we can go ahead and get started with what we can offer. And so today's objectives, they're really short, really easy. First, we're going to be defining health literacy. And after the session, you'll be able to have that definition and understand it. You're going to be able to describe universal precautions for health literacy. You're going to be able to name 3 components of health communication, of clear health communication, and identify 3 online resources you can use as tools to promote health literacy in your work or in your research or whatever you're doing. And for our agenda, we're just going to quickly go through, again, that introduction of health literacy, in which we'll cover what it is, why it's important, and the epidemiology of health literacy, who is most impacted by that. And throughout this process, we'll be introducing you to some tools, which we're going to demo for you. And again, you can use these in any setting. Then we'll move into the communication component, where we'll discuss the concept of universal precautions for health literacy and the best practices for communication. Next, we'll look at how you can use MedlinePlus as a tool for reducing disparities in health literacy. And finally, we'll discuss EthnoMed, an online tool you can use to reduce intercultural barriers to communication. So a lot of ground to cover. I'm going to just turn off my camera because it'll just make it easier, because I know having a floating head can be a little distracting. So just letting y'all know. Okay, so what is health literacy? Let's start with that definition. So there are two parts to health literacy: personal health literacy and organizational health literacy. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy, on the other hand, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health related decisions and actions for themselves and others. So we can kind of see the dichotomy here of like maybe a librarian or even a doctor and how these might play into different aspects of organizational health literacy. And then obviously the personal health literacy to which we find information for ourselves. So with that, there's a shared responsibility, and there's this really great quote by Helen Osborne, a health literacy expert, who describes health literacy as a shared responsibility of patients and providers. And so for the purpose of this class, I want us to really think about Osborne here and their definition as a shared responsibility between provider and receiver. A provider can really be anyone who provides information, and a receiver can be anyone who receives that information. And a patient or library patron or someone reading a public health message, maybe on the street, on the side of a bus, in a communication in the newspaper, really anything. So, why is it important to address health literacy? So, the simple answer is that low health literacy leads to poor health outcomes. So, people with lower health literacy are more likely to visit the ER and to have more hospital stays. So, for instance, one study showed that they're not only more likely to visit the ER, they're also more likely to return within 2 weeks. So, this makes sense because health literacy impacts one's ability to follow discharge instructions and follow treatment plans. Low health literacy can act as a barrier to effective disease self management, which is especially true for chronic conditions that require complicated self care regimens. So, people with limited health literacy are more likely to skip needed tests and underuse preventative health care. So, one function health literacy impacts is that ability to take medicine correctly, which requires numerical skills to figure out dosage and reading skills to read directions. And this is not inclusive of like one specific group, but really anybody. One systematic review, for example, on patient medication errors showed that there 19 to 59% of all medications are taken incorrectly. And I know we've kind of all experienced this when we're in the doctor's office, they're there for such a short amount of time and they're covering a lot of information. So it can be really hard to kind of pick up on those important details at times, which is why communication and health literacy can be really key. So risk factors for low health literacy. So limited health literacy can affect, like I said, anyone. However, several factors are strongly associated with limited health literacy. So for example, socioeconomic status can be one. The epidemiology on health literacy shows that adults living below the poverty level have higher rates of limited health literacy than adults living above the poverty level. There are many socioeconomic variables here that are associated with lower health literacy. Insurance status is just one example. Disability is a factor as well and can be associated with health literacy, in particular, hearing, speech, visual learning, and mental and emotional disabilities. So, here I want us to think about how these disabilities impact communication, and things that impact communication have the potential to impact health literacy. So, the National Adult Literacy Survey also shows um, also known as NALS, shows that more than half of the individuals with vision, speech, or learning disabilities performed at a level one, which is the lowest level of health literacy. 48% of individuals reporting a mental or emotional condition, and 35% of individuals reporting a hearing difficulty as performed at the lowest level. Some disabilities are also invisible, which is why communicating clearly and designing communication materials for accessibility is highly important. In the resource list I've included, which should be dropped in the link soon, it can help with accessible communication, including a tool for evaluating documents for accessibility and a best practices toolkit for the ADA for effective communication. And for those that don't know, ADA is wow, I'm losing it. Americans with Disabilities Act for Effective Health Communication. It kind of provides some guidelines for that. So older age is another factor associated with limited health literacy. Among older adults, health literacy levels vary by education level and access to financial resources. In fact, education mediates other risk factors in adults of all ages. So identifying as a racial or ethnic minority and speaking English as a non-primary language are also factors associated with limited health literacy. Some of the greatest disparities in health literacy occur among racial and ethnic minority groups. Cultural differences and language barriers impact communication and understanding. Belief systems and customs also impact response to health information as well. But low education level is another factor, which I'm sure we're all aware of, that can be associated with limited health literacy. So keep in mind, all these health literacy factors are intersectional and don't necessarily present in the same way among certain groups or individuals. However, there are those factors that can kind of tell us a story with where those gaps might be. And so for communication, effective communication is really the building block for other parts of health literacy. Um, so when health information is not successfully communicated by receiver or provider, it stifles the ability to understand, process, and use the information to make informed decisions. So poor communication can lead to negative health outcomes, as well as numerous other things. If a provider has trouble communicating what actions a patient needs to take, what's the likelihood a patient will be able to follow through? So if patient education materials don't effectively communicate that information, how likely is that person reading the materials going to be able to use that information to make an informed decision? And if the patient can't communicate symptoms or concerns to the provider, how can the provider make an accurate diagnosis or suggest an appropriate treatment plan? Health communication occurs both verbally and in writing. So print health information includes posters, webpage, home care instructions, discharge instructions, medication labels and instructions, education materials about treatment or testing options, warnings about air quality or storms, and other public health announcements. But an essential part of our shared responsibility for health literacy is communicating clearly so that the information is understood. So we can't guess who has health literacy. It's kind of faceless. One of the hallmarks of health literacy best practices is applying the universal precautions for health literacy. So to health communications, the idea behind universal precautions for health literacy is that we should communicate in a way that everyone can understand. So to do this, we need to be as clear as possible. And we know that everyone is at risk for misunderstanding. So according to some measures, only 10% of adults have the skills needed to use health information that is routinely available to us. But applying universal precautions benefits everybody. So research has shown that interventions designed for people with limited health literacy also benefit those with stronger health literacy skills. So when information is clear and is easy to act on, people feel more involved in their healthcare and are more likely to follow through on their treatment plans or enact health behaviors. So the Agency for Healthcare Research and Quality, or AHRQ, puts out a health literacy universal precautions toolkit. And in this toolkit, it provides evidence-based guidance for addressing health literacy. It includes 21 tools that you can use to improve written communication, oral communication, self-management, and supportive systems. This is a great resource for promoting organizational health literacy. So if after this class you want to dive more deeply into improving health literacy, or maybe just looking within your collection or your workflows just to see how things are presented, check this toolkit out and maybe do a side-by-side comparison. Our goal here is to communicate as clearly as possible with health literacy. The left-hand column that we see on this screen shows that we can aspire some things that we can aspire to in order to have clear communication. You can also think of the left-hand column as the behavior change if we're in that mindset. We need to implement in order to have clear communication. So the behavior being something that we need to change. The right-hand column shows how communication usually works or we want to avoid. First, to have clear communication, we got to use plain language. So to do this, choose common words that you would use to explain medical information to your friends or your family. Avoid that medical terminology or jargon that can be hard to understand at times. So for example, say stomach or belly instead of abdomen, skin infection instead of cellulitis, or eat less salt. My doctor tells me that all the time. instead of reduce sodium intake. Use words to create images with which people can visualize. For example, a runny nose instead of excess mucus. Next, we want to use simple messages and avoid complex ones. Keep your messages concise and to the point. Limit the information you provide to need to know information, not nice to know information. Sometimes we feel compelled to explain more than the receiver needs to know. I do this a lot, but that's because there's a lot of info on a topic. So research shows that few people can remember more than 7 independent items at a time. So for those with low literacy skills, that limit may be less to like maybe 3 or 5 items. This means that we need to know your goal is 3 items and 5 at most. So for clear communication, learn to anticipate misunderstanding and embrace it and confirm understanding. Often we assume that a receiver understands our message simply because they don't speak up, and they might not. The English language infers that this silence means that a person understands. Conversation is like throwing a ball back and forth. We have to make sure that they can catch the ball. Later, we'll go over the teach back method strategy to confirm understanding. But it's always good to just make sure that folks are on the same wavelength with you when you're talking anything health related or any topic for that matter. So clarify when there's a misunderstanding. Often we try to create understanding by repeating the same thing, only louder. So clarifying, on the other hand, entails using different language to clear up misunderstandings. And last but not least, use objective judgment-free language. It's easy to inadvertently shame people when we talk about their health behaviors. An example is using the term non-compliant. Instead of saying, I see here you've been non-compliant, you say, okay, so I hear you say you haven't been taking your medication a full 30 minutes before you eat. This is objective and includes factors you learn directly from the patient. So there's no disagreement or feeling of judgment. So many words that we don't think of as medical jargon might be understood by everyone. So here are a few commonly misunderstood words on this slide that we can kind of look at. Who can tell me another word or set of words for the term cardiologist or any of the terms listed here? Feel free to put it in the chat and I can open the chat really quick. Heart doctor, heart expert, lung doctor, absolutely. Lung doctor as needed. Yeah, totally. Yeah, so these are all words that can be really confusing at times for folks to really understand. And so it's kind of up to us to try to meet them where they're at and kind of put it in put a little bit of a different spin on it. And I think all of you are doing a really great job of that. But if we always assume that everybody understands cardiologist rather than heart doctor, it might just be able to be easier to fall on the assumption that we just call it a heart doctor, right? And then make that connection later. Anti-inflammatory? That's a good one, actually. We can circle back to that one, Joyce, for sure. Remind me at the end, and we can definitely look into that. But I'm glad all of you are definitely starting to think and make the connection here about how we can better adjust our language. So for the next slide, plain language sentences. Here are some more examples. So sentences written in plain language are really easy to understand. Here are some examples of sentences revised for plain language specifically. Your COVID-19 tests results were negative. I know this one scared me a lot. Could cause some confusion because it isn't negative bad. The plain language revision of the sentence is you don't have COVID-19. It's much more straightforward and easier to understand. The version of the second sentence, reduce sodium intake, could be confusing, but using plain language, it's simple to say eat less salt instead. And in the third example, take on an empty stomach, the literal words are confusing. What does taking something on your stomach really mean? And empty of what? Food or drink? The plain language version is simply don't eat or drink before taking the medication, which, to be fair, it can be a little misleading, especially if you're going in for a surgery. Don't eat or drink. Yeah, you never know. So what are the plain language principles? So in order to promote health literacy, we need to select, assess, and create print materials that are easy to understand. I'm guessing that some of you select and assess print materials and others of you create print materials. So here's some plain language principles you can use in order to make communication clear. Use familiar terms, not jargon, acronyms, or medical terminology. Chunking info is a really important part of this. So chunking info means breaking documents into separate topics. Keep paragraphs short. Use descriptive subheadings. Use more headings and subheadings with less under each heading, and using bullet points to organize information. We can post that link to the FDA as well, which will provide a little more insight into that. And then organize logically. Put your most important material first and organize your material in order of importance to the audience. Start by stating your purpose and bottom line. Include background information towards the end. Typically, when we read things from top to bottom, it's going to be the things that are on top that are going to stick the most. Write in a conversational voice versus an academic or researcher voice. You want to engage the reader. One way to do this is to use the active versus the passive voice. And an active voice means clear, it makes it clear who is supposed to do what action. It eliminates the ambiguity about responsibilities, not it must be done, but you must do it. Not masks must be worn, but wear a mask. There are some plain language guidelines as well that are going to be posted in the chat and can have a more comprehensive list of plain language principles for you all to look at. But using plain language is a key component of our shared responsibility for health literacy, thinking back to that quote. So if you want to learn more about plain language principles, I suggest taking a look at that plainlanguage.gov link. There's a really great resource list on there for you all. So there are two concepts that people sometimes confuse, and if you take away anything from this class, I think this is probably the biggest takeaway here. So plain language and readability. Readability is how easy something is to read. Readability is measured in terms of grade levels. The NIH recommends that the readability of a patient information material be no higher than a 6th grade level. There are readability calculators that you can utilize to see the grade level of a document. These formulas are based mainly on sentence and word length. However, there are a number of issues with readability formulas, so they aren't really good for making an overall assessment of whether your document clearly communicates info or is just easy to understand. First of all, online readability scores are inconsistent and often inaccurate. Secondly, readability formulas ignore most factors that contribute to ease of reading and comprehension. So just because someone can read something at a certain level doesn't mean that they can understand it or know what to do with it for that matter. If you rely on a grade level score, you can be misled into thinking that your materials are clear and effective when they might not actually be. And that's because readability formulas don't take into account the user's context or the principles of plain language. So really thinking about those sociocultural contexts here, which we'll cover later on. And by contrast, plain language addresses factors that contribute to ease of reading and comprehension, which ensures that readers can grasp the message the first time they read it. Here's a fun little cartoon for all of us, but I think the bottom line here is that readability, plain language, and health literacy are all very important. So it's important to really understand what makes each unique. And here we can see the little stick figure kind of just like, what is this? And then I'm understanding it all. And then I'm going to go make some informed decisions. Ideally, that's the process we want, but it's not always linear. It kind of takes on different shapes and forms depending on the individual and those other sociocultural factors that we were talking about. And so with SAM, subheading and chunking, here's just a great resource for you all that I think we should kind of just be put in the back of our minds when we're making material. So here we can see that subheadings and chunking, few people can read more than 7 independent items. And this is kind of just like a quick checklist that you all can do when looking at a material. So thinking about writing style, reading about the criteria of what you're trying to communicate. And as you can see, each factor listed here can be scored as superior, adequate, or just not suitable. SAM lists scoring criteria based on these 3 areas. But I want to give you all a chance to kind of like look at this and kind of take it in for a moment to really see how this might play out. And then maybe provide an example of where you might use this in the chat to try to kind of give us a grounding of where we might apply this in our daily life. So if you could just take a moment, just think about maybe some things that are like in your office or something that you share with your coworkers or even your patrons if you're in a library or your patients. What are some things that might, apply to this list, and how might you kind of review that using this checklist? I'll open the chat really moment. And I believe, yeah, Molly posted the suitability assessment of materials in the chat. But does anybody have any ideas of where this might be applied readily? Yeah. Okay. Well, we choose subheadings in the Word documents for our documentation. And let's put it on. Yeah, absolutely. Websites for sure, Morgan. Absolutely. Morgan hit it right on. I think websites are probably going to be the biggest thing, right? Blog posts as well. Lib guides. Oh my God. Yes. Lib guides are probably like the biggest thing. I know we rely on lib guides and we live and die by them, right? And then, yeah, absolutely, Kim, you can use it for many library guides. Social media, especially. Social media is where everybody's going now to get their information. So, and now more than ever, our attention spans are shrinking. You have, what, 30 seconds, maybe less, to convince somebody of the message you're trying to communicate. But yes, absolutely, LibGuides for the win. Absolutely. I can see value for in-person events or give simple directions to health campaigns. Oh, for sure. Health campaigns for sure. Great examples. Absolutely. All of these are wonderful. So with that, we're going to take a quick 5-minute break. I know we've covered a lot of ground here and a lot of information. So we're just going to include it as a part of health literacy, give people some space, put a lot of page breaks in there as well, make sure that they're pacing themselves really easily. And then we'll come back in about 5 minutes to learn about SAM and how we can apply it. And I have a really great example for y'all when you get back. I have 12:26, so we'll come back right at 12:30, 12:31. But I will be hanging out in here if anybody has any questions and looking at the chat. And absolutely, while you're breaking, take a look at that example that Molly posted for the pertussis, and we can come back and discuss in the chat. All righty, we can go ahead and start coming back. I'll give you all one more extra minute, but I just want to make sure that we stay on time. We can move to the next slide. Hopefully y'all at least took a look at that link with the pertussis and what patients need to know. Okay, go ahead and come on back. So here we see the pertussis, what patients need to know, provided by what patients need to know, or what parents need to know, rather, from the Department of Health. So here we can see, we have a really good breakdown of like what it is, but also there's a lot of words, so really paying attention. But in the chat, how would we rate this? What would we give this a rate for? And maybe some things that we notice that maybe could be clearer or maybe just not right. Adequate. Okay. Yeah. There's chunking. There are bigger headings followed by shorter sentences underneath. Okay. Adequate, adequate, adequate. Cool. Okay. So surprisingly, this actually got a superior score. And so what we kind of see here, and all of you are kind of looking at the right things, it's perfect. And even if it were adequate, I think we can always strive for superior, but adequate is still, as it sounds, adequate, right? But yes, we do have the descriptive headings here. We have 3 items under each subheading, which can make the chunking a little easier, like we discussed. And then it provides a synopsis, really, of like what it is, what those symptoms are, and how it spreads. Is there a cure? Is the lab test? Things of that nature. And it really just kind of communicates those bare bones need to know um, information for patients or for parents rather to be able to treat and seek care. But also maybe some visuals would be nice in here. That's just my personal opinion, but it did get a superior score. So, but using visuals, and speaking of visuals, let's talk about it. So visuals such as pictures, drawings, charts, graphs, and diagrams can be really effective when communicating health information because they fill in the words, uh, they fill in where words may just not be misunderstood, or they just fill those gaps rather. So visuals shouldn't be used in place of text because people can interpret visuals many different ways, just as they do words. So similar in a similar vein, like the word beauty, it means different things to different people. And there's always that saying, it's in the eye of the beholder. So same logic here with visuals. They can mean different things to different people, and we want to make sure that we're being consistent with that and that we're communicating what we need to. But however, visuals do enhance text and can help reinforce written or oral instructions. Here are some tips for using visuals in health communication effectively. So first, concentrate on the message. What do you want to get across? Think about what action you want the person to take or do. Use images that provide those visual cues. Use clear headings, labels, and captions. These can help you be clear about the purpose of the image. So for instance, the image of the left shows the mother drinking and her baby inside her also drinking. Kind of funny. And the caption says, when mother drinks alcohol, baby drinks alcohol. Alcohol crosses the placenta and circulates into the bloodstream of the fetus. That caption makes it clear what the visual is intended to convey. Use simple, realistic pictures. Research shows that when illustrating a medical concept, simple line drawing are often most effective. Use color to aid comprehension. So for example, in the Pacific Northwest this summer, there were warnings about air quality due to forest fires. The numbers about PM 2.5 on their own didn't mean much without context. And for those that aren't on the West Coast, I'm assuming that's not necessarily a good number, or maybe it is. But the public health messaging about air quality was accompanied by green, yellow, orange, red, and purple markers. So those make it easy to understand when it was safe to go outside. Keep in mind that there are variations in the interpretation of standard images. Sometimes these reflect differences in the symbolism that prevails in different cultures. So for example, in some cultures, the image of an owl represents wisdom, and in others, it represents death. So something to keep in the back of your mind about owls. And also with this image, it's also pretty straightforward with the line drawing. We see a really good example of that here. So verbal communication, let's move on and talk about that for a moment. Here are some best practices for clear verbal communication. First, we want to listen carefully. Try not to interrupt people when they're talking. Pay attention and be responsive to the issues they raise and questions that they ask. Use the receiver's words. Take note of what words the receiver is using to describe their health condition, and use those words in your conversation. Use plain language, non-medical language. You might notice some overlap in the list with the print communication with verbal communication. It's equally important here to use plain language and avoid jargon. And most importantly, slow down. If you talk too quickly, it's hard for people to understand new concepts or formulate questions. Speaking slower increases comprehension for people who have hearing loss or for whom English is not their primary language. Limit and repeat content. Repetition can help people remember information and give them more chances to ask questions. For example, you'll notice we're repeating some of the information in this webinar, such as use plain language and avoid medical jargon. Just like with print communication, keep things to need to know and not want to know. Remove extraneous information that limit the essential points, and demonstrate how it's done. Instead of just telling people about something, include a demonstration where you can. For example, if you're showing how to cough into your elbow instead of your hand, show them, act it out. Use graphics. Just like with print communication, visuals can fill in where language may not be able to communicate effectively. So research shows that people with low health literacy ask fewer questions as well. So when we say to someone, "Do you have any questions?" it's easy for the receiver to answer, "Not no." This could be because they are embarrassed, shy, don't understand, or they don't realize that there are things that they need clarification on. This is especially true when you're dealing with a heavy diagnosis or prognosis, rather. We tend to take a moment to kind of let it sink in and digest that information. So instead of saying, "Do you have any questions?" invite questions by asking, "What questions do you have at this time?" This normalizes asking questions and encourages the receiver to think about what they need, and when they need it, more importantly. It is important to confirm understanding. However, when you ask, "Do you understand?" it's very easy for someone to just say yes. Instead, you can use the teach back method to confirm understanding. Who here is familiar with that method? I guarantee you all of you have used it in some capacity in your job or even just in life. Um, Feel free to drop a note in the chat if you've used that. Or yeah, hearts are great. Yeah, the teach back method is great. Um, it sounds very simplistic, but it's very effective. Think of it like you're dealing with a toddler, right? Like, do you understand that you don't touch the stove when it's hot or after I just used it, right? Making sure that they repeat it and they understand, not just saying, "Do you understand?" We always need to make sure that we check in and we are able to do that through effective teach back methods for folks to be able to do. Also in the classroom as well. Maybe you're helping somebody with the catalog find a book. You show them once and then say, "Now, can you do it for me so that I know you know how to do it?" Easy. So the teach back method is a method to ensure that health information is communicated so that the receiver understands it. You start by breaking down the information into smaller chunks. You teach the first chunk, then you ask the receiver to teach it back to you in their own words. If they understand, you move on to the next chunk of information and do the same thing. If they don't understand any part of it, you reteach the information using different words. When you use the teach back method, it helps to convey it's not a test of understanding on the part of the receiver. One way of doing this is to say, "Would you mind repeating back the instructions so that I can see if I was clear?" The focus is on if I was clear, so it's on you, right, rather than on them to assume. When I used to work at the library, students oftentimes had trouble finding books in the library, and when I would try to explain the system to them, their eyes would just gloss over and they would get lost. And I knew once I sent them away from the desk, they were going to get confused. So instead of teaching it the way that we understand it as librarians, I taught it as if this is the book's address. This is where the book lives. This first part indicates the floor that it's on. The second part is its community. Third part is its exact address on the shelf and its little property on the shelf. Doing it in this way helps students really understand really how our library was organized, but also it provided a nice way to kind of distill that information in a way that is familiar to them. They understand addresses, they understand what they are, how they're used, and why they're used, more importantly. So similar to a home address, a book also has an address on the shelf. But doing it in the teach back method, they were able to identify each part of where that book lived on the shelf. And they were able to explain how it related to our system in the library. So just a really fun example of how we can kind of decontextualize things and put them into new ways so that people understand them more familiarly. So MedlinePlus, I want to turn to another site that can be used as a tool for health literacy. So MedlinePlus, I'm sure all of you are very much aware of this. It's an online health information resource provided by the National Library of Medicine for patients, their families, their friends, really anybody. MedlinePlus has reliable health information that is easy to understand in both English and Spanish, and best part is it's ad-free. Medline Plus is a tool for promoting health literacy because the information is presented with the principles of plain language in mind. So I'm going to take a moment and head over to Medline Plus. We're going to stop share, and then we are going to show, and then move this right over here. Where are y'all at? Oh no, please tell me I did not end the show. There we go. Give me one moment, y'all. Okay, so here we can see MedlinePlus. And so this is the landing page for it. But once we're in, you can kind of get a feel for how it looks, how it feels, and most importantly, what it's here for. So for the example we're going to go through today, and feel free to follow along if you'd like, it's medlineplus.gov. We're going to look up like just some basic health information, but before we do, I just quickly want to go over how it's laid out. So here we can kind of see it's very easy on the eye. It's kind of inviting in a lot of different ways. It's not overbearing where you would have ads on the left or the right, like some other websites that we're not going to mention. And it's just very easy to navigate. And so up here, we're going to use the example of, and it's also, before I do that, it's also written between a 6th and 8th grade reading level. So anybody can come here, look for information, and easily be able to identify what it is they're looking for and kind of take away what they need. Um, so up here, we're going to look for heart failure. And this is just an example. You can try with anything. It also does medications and things of that nature. But when we hit enter, we get another nice screen, really easy to understand. So on this particular page, we can see that the symptoms, the diagnosis, the treatment, and the prevention all are things listed within what it is. And we can, if we click read more on heart failure, here's where that is. So we see the summary about like what it is. It's really short, really easy. We see the chunking in use here. Um, and we can see, what causes it. And we also have some hyperlinks as well, that other things that are associated with heart failure. And we can see a nice little image here of what that might look like. And then it provides that explanation again. The symptoms as well. If folks are really interested, they could dive deeper or just kind of take this information to really help them have a conversation with their doctor, more importantly. I know I've done this a few times. When I go to the doctor, maybe I will Google it or I'll turn to Medline just to say, what does this actually mean? Or maybe folks just want to prepare for when they do go to the doctor so that they can try to keep up. It's a really great resource for these things. And while we're here, we're going to go back to the main page. And at the bottom, you can see a number of little topics here. So we have different health topics that you can also look into. And these are all provided by the National Library of Medicine and are vetted resources. So we don't just put anything on here. There's a very rigorous process that we go through to make sure and analyze the information is accurate, reliable, and folks will actually get some use out of it, right? But down here on the left-hand corner, I want to point to easy to read health information, which is exactly why we're here today. So here we can find a list, an A to Z list of things that that folks might be looking for. So what is acne? We can see what that is really quick. It'll take us over to exactly what it sounds like. It's not some misleading thing where it'll take you to an ad. It'll provide some context about what folks might have on their skin, as well as some treatments, causes, and who to talk to, more importantly. There's a whole list of this, so I really encourage everybody either follow along or maybe when in your free time, just take a quick look, see what's going on. There's a ton of topics and there's a whole collection that awaits you. And we'll go back for a moment because there's one other thing I want to show you all, which is really important. Health information in multiple languages. So in the chat, how many of y'all work with folks who English is not their first language? Anybody? Yeah, Mary? Okay, perfect. So this is for you. Here you can find a list of health information in different languages. Creole Spanish speakers? Yeah, absolutely. We have a whole list of information in different languages that folks can use. Yeah, sometimes, Caitlin, that's perfect. So this is just something to kind of keep in the back of your mind as a helpful tool you can pull out at any moment's notice. It's also mobile friendly. So if you were to look it up on your mobile phone, it automatically adjusts to this so that it's also easy to use there as well. And then let's go back to the PowerPoint. Bear with me all. Can you all see my slides? Or are you all seeing my notes? You see the notes? Perfect. Okay, let's switch it. How about now? Better? Oh, what happened to my chat? Okay, perfect. Thanks, Brittany. Okay, so that was PubMed. So culturally aware communication. So moving on past that, so we also want to reduce language barriers. While reducing language barriers are important um, to improving health literacy, we also need to address cultural barriers to health communication. Here are some tips on that. So cultural awareness, tailoring messages to specific groups. When we're dealing with different folks from different backgrounds, we want to make sure that we're inclusive of those and we're aware. So that's the first thing is we want to be aware of cultural norms and customs that influence communication, decision making, and health beliefs and behaviors. So to really do this, we want to avoid idioms and jargon. As Americans, idioms can be especially confusing for folks from different cultures or backgrounds, or from whom English is not their primary language. So we want to use high quality translators or interpreters when and as needed. Now, I understand that can be a barrier for a lot of folks, especially in small libraries. They might not have access to that. But using Zoom or Teams or anything like that, they can probably help provide at least the closed captionings, and they can download that transcript that can be interpreted through a translator of some kind. But needless to say, we want to make sure that we're reaching the people that we want to reach, and we want to reach them the way they understand. So really meeting them where they're at. And we also want to use visuals like we talked about and examples that reflect that audience, right? So if you're using visuals in written communication, you want to engage with people, not alienate them. So here on this slide, we can see that we have different types of folks that are presented here. So we have even different age groups as well. So we see the little girl with the pigtails in the bottom right-hand corner. We see the folk in the middle wearing the headscarf. We see two of those folks. We also have an elderly person, and we have different races. We have a lot of diversity here happening. So we just want to make sure. And I think the point with this COVID-19 message is that it affects everybody, right? Nobody's immune from it, whether it be the consequences or the actual virus. So we want to make sure that we're washing our hands. That's the takeaway. But here we can see a really good example of how those faces play out in health communications. So EthnoMed is another great resource that you can use to improve cross-cultural communication and raise your awareness of different cultures. So EthnoMed contains medical and cultural information about immigrant and refugee groups. We can go to that really quickly. Let's stop the share. And let's go to EthnoMed. Go back right here, share. Okay, so welcome to EthnoMed, everyone. So here's the landing page for EthnoMed. It's really great. I think Molly will post that link in the chat as well. But once you're on the page, you can kind of see again, similar to MedlinePlus, it's very easy on the eyes, it's digestible, not just in your face as soon as you get on. So up here, we can see that there's clinical topics similar to Medline, again, different things. But what I really want to draw everybody's attention to is the cultures tab. So over here, you're going to have a list of different cultures, and I'm sure they add and take away from this as needed, but it's always up to date and something that can be really helpful for folks. So we're going to look at Mexican just as an example. So on this site, we can see their profile. We can see who wrote it. We can see the reviewers. We can see that people are actually paying attention and updating this as needed. And as we go down, we can see a little bit of the geography. So really, hopefully having our understanding of where Mexico is, just in case folks don't know though, but it provides a geography lesson for you. The history and politics, the language, different ways of saying common phrases, greetings and displays of respect. So things that may be just different from like what we're normally used to. Etiquette as well, family life, kinship structure, It provides a quick synopsis of this. And it also, probably like the most interesting is the nutrition and the food. So for doctors, I can imagine this being really helpful to know just in the back of your mind when you're dealing with folks or working with folks rather. Cold foods, beans, corn products, dairy products, citrus, all of these things are most common um, among Hispanics and Mexicans, more importantly. Religion as well, it provides a little bit of a synopsis on that. And a little history lesson, traditional medical practices, probably the key takeaway here for a lot of folks who deal with healthcare. So, traditional medical practices and traditional diseases that are most common as well. Um, these are just things that are within that culture and really they value. So, it can really help. And when you're working with folks to really understand where they're coming from. And the site has recommendations for assisting refugees as well, which we can talk about later. But if you work with immigrant and refugee populations, I highly recommend exploring EthnoMed more. Definitely play around with it if you can and see what you can take away from it or maybe update in your library or in your resources at your job. Let's share really quick. Oh, actually, I take that back. Let's go to the next one. We can just share that. The next one that I wanted to go over is Indian Health Services. Um, Again, just like PubMed and EthnoMed, really great, easy to read, understood. But if anyone works with Native American populations, the Indian Health Service has some tools you can use to promote health literacy. For providers, you can really find a lot of valuable information, which is right here for those that are following along. There's a catalog of culturally relevant patient education materials, and you can see what those look like for providers. So patient education, you can see that there is some education materials here that may or may not just download straight to your desktop, but yeah, it looks like it might. But you can see that there's different types of areas that you can talk about. So limited added sugar, sodium in your health, healthy eating. So again, just kind of getting that synopsis of what health is and how it relates to this group of folks. But it has health literacy training as well and a white paper that focuses on the issue of health literacy among Native American populations, which describes strategies healthcare professionals or really anybody can use to improve communications with Native folks. So let's share, and then let's go back to our PowerPoint. And just a quick check, which one do y'all see? Notes or just slides? Ah, perfect. Love you guys. Y'all are awesome. And so as we wrap things up, just some things to really take away. So health literacy is again that shared responsibility. And we thinking back to that quote, it's really up to all of us to make sure that we take care of not only ourselves, but those around us and those that we care most about. So think about those universal precautions for health literacy as well so that we can ensure that everyone can understand. These are easy things that you can implement in your everyday work to make sure that that happens, or at least minimize the risk of misunderstanding. But clear health communication is always going to be the best practice when working with folks on anything health related. But using that plain language, limiting to need to know information, and confirming information using that teach back method that we talked about are all great ways that we can be aware of not only the information, but also the cultural differences that may come with that so that we can flex and understand how we can reach them better. And then there's those free online resources that you can use to promote health literacy, including SAM, MedlinePlus, EthnoMed, IHS, and the AHRQ Health Literacy Universal Precautions Toolkit. But yeah, we'll go ahead and put that code in the chat for you all. And let me turn on my camera so that I can see you all again. Thanks for bearing with me today. And if anybody has any questions at all, I will stick around for a little bit, but feel free to let us know how we did, and please let it complete that evaluation if and when you're able. We really value the feedback and we love the work that we do, and we want to make sure that we can keep doing it. And your opinion matters here, and we can really learn a lot from you all as well. And I hope all of you have a wonderful rest of your day. You should have a lot to think about and go home with, but as always, you know, we're here. If you need anything, feel free to email me. My email is right there on the screen, or just reach out to your RML if you're in a different region. But, you know, we're always happy to help anybody in any region for that matter.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.